The question is, can this polycystic ovarian syndrome be reversed? Today, we are going to be talking about an interesting topic which may be of use to you or somebody you. We're going to talk about how we can manage PCOS. So maybe you've seen the last episode on health that we talked about my experience or my journey on PCOS, and today we're going to be talking about how you could manage PCOS yourself. However, there has been a video where there was a detailed description of what PCOS is, right? So today we're going to be talking about ways you can manage this condition better. So before we continue, my name is Nailum. I'm a nurse who is currently practicing in UK, and on this channel we do a variety of things. We talk about health, we talk about beauty, we talk about lifestyle, and we talk about family content also. If this is something you like, please head on and join the family by hitting the subscribe button. Don't forget to put on the notification so you'll be notified whenever I post a new video. And if you would like, just give us a thumbs up on this content so that the algorithm will know that you love it and share it to other people. Like I said earlier, in today's episode, we will be looking at how you can manage polycystic ovarian syndrome better. You already know I had an interview with a sister and a friend of mine, Ugochi, God bless her, where I talked about my experience and my journey with PCOS, even how I overcame my secondary infertility that was as a result of this condition. And in today's episode, I'll be talking about how you could manage polycystic ovarian syndrome so that you can have a better life. So first of all, before I continue with anything, I want to just have a quick overview of what polycystic ovarian syndrome is. So as the name implies, polycystic ovarian syndrome, it just means that it is a condition, a hormonal disorder, where the ovary does not produce matured eggs that can be used, or probably does not even produce any egg or ovum in a month. So in a cycle, you're supposed to go through the ovulation phase, the menstrual phase, and the rest. So now, during the ovulation phase, there's supposed to be some matured egg, which is the follicular stimulating hormone, which is FSH, should help to mature. Now, in the case of polycystic ovarian syndrome, the brain does not release follicular stimulating hormones. So what happens is the luteal hormone starts producing testosterone or the androgen, which is a male sex hormone. So when this androgen is being produced, there are multiple of them and immature eggs as well, which also results to no ovulation, which is anovulation or oligoovulation. So basically what happens in a year, you have less menstruation. Does it make sense? One of the symptoms of this polycystic ovarian syndrome, forget about my medical jargons, is number one, irregular menstruation. You have fewer menses. You might have fewer than 9 menses in a year. So it can be elongated from 30 to 35 to 40 to even 60 days. And most times people don't even see their menstruation unless there is a medical aid. So in my case, I started having a very long menses. At first, I did not really take it as anything because I thought it was normal. But I now recognize later that it wasn't normal not to have your menstruation come regularly. So now I want to state something clearly. If you're a woman out there and you are 18, you have seen your menstruation, which is your first menstruation, you have to pay attention to this, because as a woman, for you to reproduce or for you to function optimally, your menses should be in check. What do I mean by that? It should be irregular, it should be in check. So if anything is wrong with your menstruation, you don't sweep it under the carpet. Our menstruation is our vital signs. What do I mean by vital sign? It's a significant sign to show that we are okay or we are not. Now, there are different reasons why we even have this in the first place. Although the main reason is not very clear, but there are different reasons that predispose you to having this. One is when you have metabolic syndrome, or you're having insulin resistance, your glycemic index is high. However, research has shown that some people also come down with polycystic ovarian syndrome, just a fraction of them, without having either metabolic or insulin resistance. So those ones are special cases. The reason why they're having polycystic ovarian syndrome might be idiopathic. However, there are things to look out for. First of all, let me talk about the signs and symptoms before we continue. So one of the signs and symptoms to show that you might be having issues, like I mentioned earlier, number one is that you might be having irregular menstruation. 2, you might be having excess hair than normal. Maybe you don't normally have facial hairs, you start having hairs in your chest and back. So another thing that can actually start happening is that you would see that you start having acne. You have acne prone skin, even when you don't have acne prone skin, you start having a lot of acne. So we have another one you might start experiencing is that you start putting on weight that is not explained. You start putting on a lot of weight, and most of the weights are around the visceral area, which might be pointing out metabolic disorders or metabolic syndrome, as the case may be. There are lots of signs and symptoms, but these major ones I mentioned actually shows you that there is something wrong with you. So enough of this. We've talked about the overview. Please make our time to see the video above so that you can have a better understanding on this. Now let's talk about the management of polycystic ovarian syndrome. As we know, for your menstruation to be regulated, you have to first of all see a professional. So for you to see a professional, then will look at you, take you through the diagnostic process to make sure that you actually have this particular condition. You might come across this video and you say, oh, this is happening to me. I think because of the signs and symptoms I'm displaying, this might be happening to me. Actually not be happening to you. It might actually be something else. That is why immediately you have issues or you are suspecting something, go see a doctor, go see a gynecologist, let them run a test on you. Hormonal profile. As a woman, if you are past 18, you should do a hormonal profile so that you can have a baseline for you to monitor yourself again in the future. Then if you are past 25, please, it's very essential for you to go on and do a hormonal profile. Hormonal profile for you to check some certain hormones in your body. There are about 7 of them. I'll try and see if I can remember them. Number 1, you have to check for follicular stimulating hormone, luteinizing hormone, LH. I have to check about thyroid glands. I have to check your insulin resistance, your insulin levels as well. You have to check for testosterone and your androgen level. You have to check for your progesterone. You have to check for your estrogen as well. So if the hormonal profile, you should go and check immediately you are 18 and 25 consequently. So I said 18 and 25 because 18 you are mature and you understand, and that is where your life is beginning. You're expected to be a bit stable, right? And it gives you a baseline. Then if you are above 25 or if you're 25, you're entering the peak of your life. So you have to be sure that you're okay hormonally. So now go to the doctor if you're also seeing some of these signs and symptoms. Let them check you and see if there is something wrong with you, because one of the reasons why mine was not controlled on time or wasn't managed on time was because I didn't know at the time. I didn't pay attention to it and I did not check. And let me tell you, if you don't check, you won't actually know. So you have to check and find out. And that was why I found myself for a long time thinking that, oh, it might actually be something else, whereas the signs has always been showing that there is something wrong with me. So don't be like me, darlings. Go on, check yourself out. So the first thing I will be talking on the management of this thing is your diet. Let me paraphrase it. Weight management. Research has shown that if you can lose at least 5% of your body weight, you can be able to manage polycystic ovarian syndrome signs better. So now, in the context of losing weight, the first thing I will start talking about is your diet. Oh yes, your diet is very important. See guys, I am going to talk this passionately because me for one, how do I want to put it so that to make better sense? I have been in this shoe. I wore the shoe, so I know how it is, right? So what you eat makes you or breaks you, especially when you're going to be in the category of people who have insulin resistant or trying to have insulin resistant, people who their glycemic index is high. I've been talking about resistance, insulin sensitivity for a long time, and I've not explained what it is. So insulin resistance is just for insulin, which is a hormone that converts your sweet foods, your starchy food to glucose. So immediately you ingest this food, what happens is your body produces insulin to quell it. Now, sometimes because of age and other factors, there is a probability that due to lifestyle, you are now beginning to overwhelm pancreas. But as you grow older and you start eating unhealthy diets, what happens is that the insulin level keep on spiking because it is always triggered. It can get to a point where the insulin level becomes so high that it will not have much effect on your glucose. So you will now become insulin sensitive. Now, if you become insulin sensitive, what happens is that your blood will be saturated by insulin and it will start obstructing or start messing around with other things in your body. That is how it goes to the ovary and starts messing around and stopping body sensitivity to the production of follicular stimulating hormone. So what am I saying? You must pay attention to the food you eat. It's good for you to be smart about it. What you eat can make or mar you. Currently, I'm in a journey of a healthy meal. So what I did is I lowered my carbohydrate intake, right? I had to lower my carbohydrate intake so that I can increase other ones that my body will be needing. Your body needs protein, your body needs fats, Your fat can give you energy. So if you're looking for an energy food, your fat can give you energy. Most times than not, your starchy food, what it does is that it increases your craving because it has a shorter digestion time. Within the 2 to 3 hour window, your body has already started using your glucose, right? And when this happens, is that it gives you a spike of energy before it crashes, because as it's taking off, it crashes as well, right? But if you take more of your protein diets, protein which has some bit of the energy giving food in it prolongs one, gives you the sense of fullness. So if you eat a lot of protein, eat a lot of fat, it makes you get filled and also gives you energy as well. Now, I'm not saying you should stop your sweets. I'm not saying you should stop eating your diet. This is for you to eat it. You should eat it in a proportioned quantity. At this point, you don't need them. So if you must eat it, it is fine. You can eat your eat, but you should be eating in a very little quantity. It should be the least food you eat in a very little quantity. And for you to be smart about it, you should be eating your carbohydrate meals last. Does it make sense? Your protein should come first. Your fats, your vegetables should come next, because vegetables contain fiber and vitamins, right? And this fiber, what it does is that it slows down the digestion of food. So when it slows down the digestion of food, when you're eating other things, you get full. And that's why you get full on time. And when you start feeling hungry, what happens is that when your body starts using the stored up energy, that is when you start losing weight. Because remember, the excess glucose we take are being stored in our adipose, are being stored in our liver and every other part of our body. That is why we increase in size. People like me. By the way, mine is different. I just put to bed in December. I'm trying to lose my baby weight. That aside, so let's continue. So your diet is very important. So I'm just giving you a brief overview of what you're expected to eat. So you're supposed to make sure that your meal are proportioned and you're giving gaps, allowing your body to utilize the food you eat. So people that eat, you keep on eating in close interval. What happens is that you're stressing your pancreas, you're making insulin to become sensitive, and your body will start resisting insulin, which I am sure you don't want. Glycemic index is simply your glucose levels. Your glucose level is high, and this can trigger diabetes, right? You don't want it, or you become borderline diabetic. So we have talked about diet. I think I want to talk about something very important as well, which is exercise. So now, if you're talking about polycystic ovary syndrome and you're not doing a form of activity, you are still not going to achieve the optimal results you're looking out for. Diet is very fine, it's very beautiful when you do it, but you should also understand that you have to exercise. Your body part has to know, your organs has to also exercise. So it is always good to do a form of exercise. Exercise can be walking, going to the gym. It mustn't be something strenuous. Maybe taking a walk, running faster than your shadow. I like saying it like that. Probably going around your treadmill, doing 1,000 walk work. You can even do some home exercises, which is your dance exercise. That is one of my favorites. Just put on some music and shake your body. You can see that when you are done with the whole shaking and the whole thing, you will feel a lot better. Also, it is always good for you to take a walk around the environment because your body is exposed to vitamin D, which is very important. All right. So now we've talked about exercise. Remember that the exercise doesn't have to be strenuous. Another thing under exercise is to turn those fatty tissues to muscles. Maybe you can do your aerobics and all. You can still put a little bit of weight that can help tone yourself. So your ability to turn your fats to muscles helps to tone you down and also reverse your polycystic ovarian syndrome. Another thing also you have to look out for when doing it is you have to make sure that you are not overdoing it because it can be counterproductive. If you're overdoing it, maybe you're straining yourself while exercising, you might likely start producing, as a woman, start producing testosterone, and that is not what you need. I can go on exercise, and we will not go here. Let's talk about the next point, which is stress management. Stress management is very important because whenever you are stressed or you're undergoing a stressful condition, what happens is that your body starts producing some hormone called cortisol. And cortisol is a very dangerous hormone because it does a whole lot, both your hair, your skin, everything hears it. Cortisol is a very toxic hormone to the body because it starts disrupting most of the equilibrium, most of the normal things that's happening in your body. Stress has a way of disrupting it. So now, we're not saying you can't have stress. Stress has come to stay. But you have to have very good coping mechanisms to manage stress better. Does it make sense? So when you have coping mechanisms set aside to manage stress better, it helps your body, it helps your mind. Anything that is going to disturb you emotionally, work on it. If it's journaling, if you're going to do it, if it's talking to a family member, if it is taking a walk, if it is exercising, because there is something good about exercise as well. I did mention it. Whenever you exercise, there is this hormone endorphins that is being released, which is natural mood lifters or to relieve yourself. So maybe you want to take a walk, and that walk might be all you need. Maybe you want to just go and run faster than your shadow, and that is what you need, right? So try as much as you can to work on your stress levels. It should be done, because if your stress level is still there, it will definitely affect you while managing cystic ovarian syndrome. Now, there is another thing that is very important that I would want to include in the list, which is taking your supplements. So there are some supplements that helps a lot in managing polycystic ovarian syndrome. Supplements is not to replace the normal meal you're eating. So name is supplements. Women can have the ability of benefiting from these supplements. And like I said, your meals, your exercise, which is the lifestyle changes you have to implement, comes very handy, right? So for you to add to whatever you have been doing before, you can get some supplements which can help you manage this polycystic ovarian syndrome better. One is, not at all what it does basically, is to mimic insulin and helps to manage your insulin resistance better. Another one is your omega-3 fatty acid. The omega-3 comes, I think, is in colic leaf oil. So there are some other combination supplements that has three. Omega-3 is very important because it helps in inflammation and also in production of some of these your hormones. So please take supplements that has omega-3 in it. Another one is vitamin D. Vitamin D also helps insulin sensitivity as well. That is why taking some walk in the morning is also very important, because that is the natural way to get vitamin D. However, every woman who is still their childbearing age should also incorporate vitamin D in their supplements. To conclude, all these things are things you can put into place to help you manage your polycystic ovarian syndrome, which is PCOS, better. However, there are other things, medical protocols or medical steps you might take that your doctor can give to you. They can give you metformin, which is a medication that helps to manage your glucose levels and your insulin better, right? They give you this medication depending on what you need. Now, there are other medications as well. They can give you birth control pills. So these birth control pills also helps to regulate your cycle and be exactly what you need to make sure that your cycle is okay. Now, if you're looking to have babies, probably you're having secondary infertility like I did, there are some medications that have been proven to help people conceive better. Some of these medications are medications that helps stimulate the ovary to produce egg. Apart from the medication and the IUIs, you can go ahead to do IVF, in vitro fertilization, that is taking out your egg, prompting your eggs to be matured, taking out your egg and that of your husband, which is the sperm of your husband, fertilizing this egg outside and implanting it. So this can be another option you might take. You would want to ask me, now we have talked about measures to put in place to manage your polycystic ovarian syndrome. The question is, can this polycystic ovarian syndrome be reversed? My answer is yes and no. No, technically it's by 100% not reversed, because this is a phenomenon that if you don't continue with what you're doing, you might relapse. So what do I mean? Yes, that in case that if you continue in watching what you eat, making sure that you are in check. Watching what you eat is very important. Your diet is very important, because insulin resistance has been a major cause, a major factor in people who are yet to conceive. Reducing or putting the carbohydrate meal in the back seat, making sure it is in the back seat, let it remain in the back seat, also is key to make sure that you are living well. These are the things you can do to make sure you're doing well. And when you continue with also your work, your sleep pattern is also important. I didn't talk about sleep pattern. If you're not sleeping well, your sleep lifestyle will still be messed up. You need to have a regular sleep pattern, right? Very important. For nurses like us that might have naivety, I don't really know what we can do. To be fair, I don't. But I know that God is going to help us. I hope you enjoyed this section. If you do, please give it a thumbs up and subscribe to me if you're not yet subscribed. Turn on the bell notification so you whenever I post any new video. Comment in the comment section, and I'll see you in my next one. Bye for now.